Okay, welcome everybody to Therapy Ed online office hours. I'm really glad you've all joined us. For some of you, this might be your first time. For others, perhaps you show up every Tuesday. And we're very happy that you're using our resources to help you prepare for the NBCOT exam. My name is Donna Costa, and I will be your instructor for tonight. And the topic of tonight's presentation is going to be the application of mindfulness to certification exam preparation. Now I'm going to have to keep stopping to let people in. Okay, so you see my name, and I will, at the end of the presentation, give you my email address so that if you have questions, you will be able to contact me and have your questions answered. So I'm one of the 24 or so instructors that work for Therapy Ed, and I have done so since 2008. So I travel all over the country teaching the NBCOT exam prep course to students just like yourselves. I've been an occupational therapist for 49 years. Actually, in March, it will be the big 50. My clinical practice experience is in mental health, although for the last 25 years, I have been teaching full-time. Currently, I'm the program director at the University of Nevada in Las Vegas. And that it's an entry-level OTD program that was just granted accreditation status. Before that, I taught at Touro University in Nevada, also the University of Utah, and Stony Brook University in New York, and Touro College in New York. So I've been around a number of states in the United States. But along the way, part of my practice in mental health, and if you work in mental health, you know that lots of people suffer from anxiety and, of course, depression. And so years ago, I decided to take a course in mindfulness. It was a professional training course. It was a week-long silent retreat in what is called mindfulness-based stress reduction. And the teacher for the course was Jon Kabat-Zinn, who is known to be the father of mindfulness, certainly in the United States. And it was very hard. It was my first silent retreat. I wasn't sure what I was getting myself into, but I wanted to learn more about mindfulness. And like all of you, I had a very busy life. So grabbing 10 minutes here and a half hour there was really not working real well. So the advantage to taking a training that's immersive is that you really learn it well. We were told there was no wearing watches, there was no eye contact with other participants, there was no reading, no computers, no phones. There was just learning how to be mindful. And that was back in 2001. So I've been practicing mindfulness and teaching it to people since then. From there, I learned mindfulness-based cognitive therapy, which was an intervention created around 2002, which is actually when I took that first training.
Oh, you want me to sit down here?
Yes. Can I ask everyone to mute yourselves, please? Specifically, this intervention is for people with depression. And since I worked in a mental health practice setting and most of my clients did suffer from depression, I thought that was a really good thing to learn. But a lot of the patients that I worked with that had depression also had chronic pain. And so my next intervention was learning mindfulness-based chronic pain management. And for that, I traveled up to Canada and worked with a physician who had developed a particular course for that and became certified. So every time I took a training, I took the certification course. And of course, every time my students heard that I was teaching mindfulness, they always had the same reaction. When are you going to teach us mindfulness? And I remember saying to them, when you have time. But as college students, you don't have much time. Many of you are working and going to school full time and studying, and there's not enough hours in the day. And that's not counting family and home life responsibilities. So I learned about the COTA mindfulness program, which was specifically developed for college students. And the advantage of it is that it's a shorter intervention. So instead of spending the usual 2 hours for each group session in the other formal mindfulness programs, COTA is only an hour and 15 minutes. And instead of giving people an hour of homework every day, we give students 10 minutes of homework a day. So it's a much more manageable intervention. So like the other interventions, I also became certified as a teacher in COTA. And I've been teaching that to college students for the last 7 or 8 years. So I've worked with lots of people with psychiatric conditions, but also the mindfulness-based stress reduction program was involved in a research study with that, with women who have urinary urge incontinence. And one of the things that we learned by running the program was that mindfulness was as good as medication. It reduced the number of episodes of leakage that these women were experiencing. And so that was huge. Mindfulness-based cognitive therapy, its claim to fame, if you will, is that it reduces the risk of depressive relapse by as much as 50%. And, if you know anything about depression, you know that if people have had 3 or more episodes of depression, the likelihood of them having another episode of depression is somewhere between 80 and 90%. So it's very, very high. So I still practice all these different forms of mindfulness and actively teach whenever I can. And so in teaching this therapy ed course to students, I have encountered many, many students who are very anxious about taking this exam. Some of you in the room may not have been successful passing the exam. Others of you have yet to take it, but you share one thing in common. You're all very stressed about it because it is a high stakes exam. And so mindfulness, we're going to first look at what does mindfulness mean? Because a lot of people think it's about stress and stress management. And mindfulness, in essence, is about paying attention. So we're learning how to focus our attention. And if you think about it, most of the time our minds are all over the place. Even right now, you're listening to me, but you're probably doing other things as well. So first and foremost, it means paying attention in a particular way. And we do it intentionally or on purpose. The other thing is we are focused in the present moment. And if you think about it, most of us are thinking about things that have already happened that we can't do anything about, or we're thinking about things that are going to happen, which we also don't have much control over. And we do all of this without any judgment. So we do the best we can, okay? And we don't judge ourselves. So why is this so important? Because we're all multitasking. And we, if, for example, talk on our cell phones while we're driving, or riding rapid transit, we're scanning the news while we're returning emails. And because of all this rushing, we lose connection with the present moment. We stop paying attention to what we're doing or feeling. Somebody says to you, "What'd you have for lunch?" You don't even know if you had lunch, much less what you ate. So mindfulness, in essence, is the opposite of multitasking. The idea is, can we focus our attention on what is happening right now and accept it without judging? So you might say, well, what has this got to do with me? I'm just a student. Well, it's actually got a lot to do with it, because there's been a number of studies that have looked at mindfulness and test taking. And there are lots of things that affect how well a student actually performs on test days. When you are taking a timed examination, that presents additional challenges. And we have to, in order to be successful on the exam, we have to ignore distractions, stay focused. You've got to pace yourself on the questions so that you get them all answered in the 4 hours. You have to be aware of your own knowledge and where there's gaps in your knowledge. And then you have to use decision-making, your cognitive skills, to solve these individual problems. All right, so effective test taking, particularly on timed exams, requires self-regulation and strong self-awareness. It's not just about intelligence. You all got into OT school, and OT programs tend to only accept the brightest of the bright, okay? But you're under an enormous amount of stress getting ready for this exam. The other big component of test taking is time management. So from the same article, we have to resist distractions. We have to have willpower to take decisive action. But we've got to keep track of the time. How much time is passing? How much time is left? How much time is being spent on each question? And if you've taken the therapy ed course, you know that we say approximately 1 minute on every multiple choice question and 10 to 12 minutes on every simulation question. So you've got to be mindful of the present situation. You can't be thinking, oh my God, I've only got 3.5 hours left. You've got to think about the question right in front of you. So being present in the moment is what we call mindfulness. Okay? We're not judging ourselves. We're not calling ourselves stupid or beating ourselves up because we can't focus. Okay? Our minds like to be busy. That's what we do all the time. So the other thing that happens with this exam is that we've got to pay attention. And attention is really central to this concept of mindfulness. Okay, how do we process information? Okay, we're sitting on a chair, on the floor, on whatever, and we're trying to focus on our breath. And our minds start wandering off. Well, as soon as we're aware that our mind has wandered off, we need to bring it back. Okay, you have to do the same thing the day of the exam. Okay, you're going to be focused on a question, and then you're going to start thinking about something else. Oh my God, if I don't pass this test, then I'm not going to get the job. I'm going to have to move back in with my parents. My loans are going to default. And suddenly you're thinking about your financial situation, your personal situation, and you've totally lost track of the questions. Okay, so mindfulness benefits self-regulation by helping us learn how to pay attention. So the ability to pay attention is really key to learning effectively. And you've probably been told many times since you started school way back when that you had to pay attention to what you were doing. But that person that told you that probably didn't teach you how to pay attention. You can't force yourself to concentrate. You can't say, I'm going to conquer this. I'm going to hit the books. I'm going to nail it. It makes it sound like we're going to war. To set our goals, we need to set the goals we want to achieve. So you're all here because you want to pass this NBCOT exam. Okay, that's your goal. In order to do that, you have to be able to stay focused for 4 hours. And that's a long time in a very high stress environment. Okay. So studies have really shown, and it's beyond studies. What mindfulness does is help us learn to pay attention. And the first time we sit down to do it, our minds are going to be all over the place. And we're probably going to say, I can't even do this. That's a judgment. We don't want that. You're aware that your mind has drifted off, you bring it back. Okay. Same thing when we're working with a client in OT. They start doing something, then they get distracted. What do? As the OT, we redirect them back to what they were working on. And that is called habit training. Eleanor Clark Slagle is credited with developing this concept. So we're going to use that same concept of habit training to prepare for the exam. Okay. So we're going to do that with using information from this Koru mindfulness program. Because ultimately, mindfulness is about learning to pay attention to the present moment. And there have been research studies done with college students that show that it reduces stress, it improves mood, and improves academic performance. Okay. Now, I'm going to encourage you to, perhaps after this session tonight, to go to the Koru Mindfulness website, korumindfulness.org. And you're going to see when you get to the web page at the top, the right-hand toolbar says Student Resources. You're going to click on that. And then when you get to the Student Resources page, there's another tab that says Resources. And when you click on that, you're taken to a whole bunch of free guided meditations. And those you can play right from your computer, or you can download them. We also have an app, which costs $4.99. And then you can download it to your phone and have them on your phone at any time of day or night. So that's up to you. You could try to just sit and pay attention for 10 minutes without a recording. But most people find that listening to someone else guiding them is very helpful. So I mentioned to you that there was a study done on the Koru mindfulness program back in 2013, so about 9 years ago. This actually developed at Duke University. And they had several hundred, if not 1,000 students in this study. And what they found was that it reduced stress symptoms. It improved people's sense of psychological well-being, and people's sleep got better. So that, in essence, helps promote student health. Okay. The other thing that we address in the Koru program is a sense of gratitude. And I don't know about you, but I know I spend a fair amount of time complaining about stuff, things that have happened, traffic, people I don't like, what they do. And we can actually become chronic complainers. And so one of the things we do in the Koru program, we ask people to write down every day 2 things that they are grateful for. And it makes a huge difference because over time, people start thinking more positively. Okay. And that positivity is also very helpful. So we're going to spend a few minutes actually learning how to do this. I'm going to guide you through just a short sitting meditation practice. and we'll see how that goes. So you're probably already sitting down. If you are lying down, I would encourage you to sit. And we usually talk about sitting in what we call an erect and dignified posture. Imagining that there's an invisible string pulling up your head, neck, and torso. So we're not slumping in our chair. We're sitting up nice and straight and tall. And then we close our eyes if that's comfortable for us, but you don't have to. You could just gaze downward towards the floor. And now we're going to let go of all the busyness of the day, all the running around we've been doing, all the decisions we've been making, all the anxiety. And we're going to focus all of our attention on our breath, not changing it in any way, but just watching each breath as we breathe in on the in-breath, and then breathe out on the exhale. And we're just going to continue to breathe in this way, focusing on one breath at a time. Breathing in and breathing out. And noticing where in your body you feel the breath the most. So to help you with that, I want you to put one hand on your chest and the other hand on your belly. And just continue to breathe the way you've been breathing. And notice, where do you feel the breath the most? Maybe at the level of your nostrils, aware of the coolness of the air as it enters your nose on the in-breath. Or maybe you notice your chest and rib cage rising and falling as you inhale and exhale. Or you might notice your abdomen expanding as you inhale and then flattening as you exhale. And right now, it doesn't matter where in your body you feel the breath the most. We're just paying attention to sensations in our body and to our breath. Just this one breath coming in, just this one breath going out. And as you take in this next breath, I want you to breathe deeply down into your belly so that you feel it expand as you inhale, and then flatten as you exhale. And just keep trying to breathe this way, breathing deeply into your abdomen and feeling the air leave as you exhale. And you might become aware of thoughts swirling around in your head. And if that's the case, just acknowledge them. Noticing that your mind likes to be busy and bringing your attention back to the breath, expanding the belly, and then exhaling and feeling the belly flatten. Now putting your hands both back in your laps again, as you just continue to sit here and breathe until you hear the sound of the bell. And listen to the bell as the tone dissipates. And stretching your arms out to the side and then up above your head in a big full body stretch. Stretching up towards the ceiling. And then slowly and mindfully lowering your arms back down until your hands are back in your lap. And opening your eyes if they're still closed. So what did you notice in this brief introductory meditation?
I felt pretty relaxed and calm.
Great, thank you, Olivia. Anybody else?
I found it hard to let myself relax. I just like kept having my mind go back to all the things that I have to complete before I could relax.
So here's a pointer, Kately, sorry. If you think about it, everything we do during the day is goal directed, right? There's a purpose. And mindfulness is not goal directed. So we're not doing this in order to relax. We're doing this just to be in the present moment, to experience life in the here and now. And a byproduct of that is that we're probably going to get relaxed. We might even get sleepy. Okay, but that's not the intent. The intent is to be in the present moment, no more and no less. So it may help to take the pressure off you. You don't have to relax, right? You just have to be aware of what's going on right now. So when I teach people mindfulness, we try to set aside 10 minutes a day for practice. Anything you do regularly becomes a habit. And some of you may be taking the exam very soon. Some of you may be a few months away. But if you start now, every day, then come the day of the exam, you'll be able to just close your eyes and breathe and center yourself, focus yourself, help yourself pay attention. So on the Koru website, you're going to find that there are a variety of free guided meditations. What we just did is called belly breathing or breath awareness, but there are others. There's a meditation called the Gathas, which is a meditation poem. And you kind of sync your breath to the words of the poem. Some people like that. There's a body scan, which is a very relaxing meditation where you literally focus your attention on one body part at a time. Dynamic breathing is an energetic kind of breathing where you're breathing very fast, but it also serves to focus your attention. You'll find a walking meditation. Sometimes people have trouble sitting still, and it is possible to meditate while you walk, but you need to walk slowly, all right? Not a power walk. Guided imagery, and there's several others. So I would encourage you to experiment with them and perhaps settle in on one. But I usually tell students that mindfulness practices are not one size fits all. there's going to be some of these you really like and some of these, nah, not so much. And that's okay. We're all different people. So you want to find a couple that will work for you, that will help you learn how to focus your attention and be in the present moment. So you're going, oops.
You're muted, just so you know.
Okay, there we go. You're going to get out of the mindfulness practice what you put into it. The more regularly you do it, the more it will become second nature to you. And as I mentioned, OT is already founded on the principles of habit training. So that's exactly what we're doing right now. 10 minutes every day is more than enough. And you're probably spending, we recommend, 2 to 4 hours a day for 4 to 6 weeks before the exam. So why not take 10 minutes out to actually practice some mindfulness? You will find over time that you can bring down your anxiety level. I've attached a couple of reference slides. I'm sure people don't have a lot of time to engage in reading more articles. But there are some that you might find interesting. This PowerPoint will be posted on the Therapy Ed website, along with the recording of tonight's session. And so you'll be able to refer back to it if you need to. So what I would like to do now is to open up the session to any questions you have. We can talk about mindfulness or any other aspect of exam preparation. But the rest of the time is for you. That means somebody has to unmute themselves and ask a question. Lindsay, go ahead.
Well, yes, I'm wondering, I just lost my father, so I'll be starting field work soon, and it'll be at like a sniff. So do you have any suggestions on how to not, I don't want to break down crying in field work.
Right. So that's a good question. And I
do
have had,
tell the supervisor, sorry for the interruption.
okay, you are going to tell the supervisor that you just lost your father?
Oh, no, I'm asking if you should, or if you should tell employers if you suffer from depression or
Yeah,
anxiety.
so okay, so there's pros and cons with that. The one thing is, I mean, lots of people these days suffer from anxiety and depression. Some of you may have had accommodations in the classroom related to that. And if that's the case, you have to make a decision on whether you want to disclose it to your fieldwork site. And nobody can really tell you what to do. It's a decision you have to make. My experience is most students don't want to, but sometimes you need to. Now, if you haven't had an accommodation, and it's a situation like you just described, Lindsay, where you've had a recent loss and you might be very sad, it's certainly okay to tell the supervisor at the start. But I think it has to come with a statement that despite that, you want to do the best you can, and you want to learn as much as you can on field work, so that the supervisor doesn't see that as an excuse. for poor performance. Now you could wait and see how it goes. There's nothing saying you have to do it in the first hour of the first day. It may be that you're so busy that you don't have time to think about it. On the other hand, there may be older male clients that remind you of your dad, and that might stir up some feelings. So you don't really know how you're going to respond and how you're going to react until you're in the situation. I would definitely keep in touch with your academic fieldwork coordinator at your school. And if you are having trouble on fieldwork, I certainly would reach out to the fieldwork coordinator, who could probably help you manage the situation better, perhaps talk to the supervisor with you. You know,
Thank you for that.
it's okay.
This will actually be a second field work. You know, my coordinator told the supervisor last time, so with nobody knowing, you know.
So all you can do is, you know, let's face it, in our everyday life, there are people in our lives that remind us of somebody else. And sometimes that's a good thing, and sometimes that's not a good thing, right? And we have to sort out our feelings all the time. And we have to find a way to put them aside, because you're learning to be a professional. You've got to put your own feelings aside to help the person who's in front of you. Now, usually what I find is our own personal experiences help us be a better therapist sometimes, because we have empathy for the people that we work with. So I wouldn't obsess about it and worry about it. I would try to take each day as it comes. And you certainly can use mindfulness to help you keep your anxiety in check. But you're going to have a lot of work to do. You're going to have evaluations to do and treatments to provide and notes to write. And you are going to be very busy. So that actually may help you, assuming you can focus. And mindfulness can help you focus. So it all comes together. But I wish you the best of luck,
Yes,
Lindsay.
thank you.
You're welcome.
Thank you very much.
Anybody have any other questions?
So you talked about just kind of stopping yourself when you find that your mind is wandering. I kind of have the attention span, like after like an hour and a half, I'm kind of just, it's rough for me.
Yes.
And I was just curious about like any techniques you have for that, or is it just kind of just, okay, just be mindful that you're drifting away and bring yourself back type of thing?
So what you're talking about, a lot of students, you know, they can study, they do well on the exam, and then they hit a wall, right? It's like they're their max. So when we talk about setting up a study plan, you know, and I mentioned 2 to 4 hours a day for 4 to 6 weeks before the exam, you have to grade that up the same way you grade treatments for a patient. So we're not going to start with 4 hours a day studying. We're going to start with 1 or 2. And then when we get good at that, we're going to go to 2 and then 3 and then ultimately 4 hours. And it may take us 4 weeks to get to being able to sit in a chair for 4 hours and pay attention. But remember that on the exam, if you pace yourself well, you should be able to take 1 break every hour. Okay. And so after the first hour, you take a break and you go to your locker and you get, you know, you can have small snacks and beverages in your locker. things that are going to, pump your energy up a little bit. Maybe that's a little drink of water. Maybe it's, I like Diet Coke, but everybody has their own thing. You don't want to have a snack that's going to, wait. Like I use the example of coffee and donuts, right? Coffee and donuts is great in the morning. It gives you that boost of energy, but then an hour later, you kind of crash, right? So you want to grade up your ability, and you will see, particularly if you do this and you practice mindfulness, you're going to be able to handle distractions better. But also remember, you should be studying in a place where there aren't a lot of distractions. And if there are, get some headphones, okay? If that's not enough, put earplugs in and then the headphones on. Turn your phone off so that you're not distracted by the phone. Turn the messages off on the laptop so you're not seeing the incoming mail. All right, that you're focusing your attention on just the material in front of you. So what are you doing? You're training your mind to pay attention. Okay, and you'll find that wall that you hit at an hour and a half will, become 2 hours and then 3 hours and then 4 hours. But even with that, don't be heroic and think, I got to get through this exam without taking a break. That's probably unrealistic. Okay, so you want to count on taking a break, stretching, moving, getting something to eat or drink, going to the bathroom. All of these are things that will help you energize. Did that help, Olivia?
Yes, that's helpful. That's helpful. When you say, oh yeah, get up and take a break, I personally get nervous because in school, I was always like the last one to finish my exam. My grades were always fine, but it takes me a while. And then again, I get distracted. My mind wanders, and then I'm like, okay, so that's part of what messed me up. So I guess that just all goes into training my mind to focus, I guess.
So again, you can use, 10 minutes a day of mindfulness training to help you focus your attention better. It will help.
Yeah.
Okay.
Yes.
Other questions? Anything related to exam prep or mindfulness or Katie?
Hey, so going off of what you just said, it's a break. Oh, sorry. Is someone else talking?
Go ahead, Katie.
Okay. So you said about one break every hour. Would you recommend like a 10-minute every hour, or some of them be shorter?
Well, the thing is, the day of the exam, a break is always going to be around 10 minutes because they have all the security procedures. So when you leave, you have to be fingerprinted, you have to show your ID, they have to sign you out, then you leave. Then when you come back, and they only process one person at a time, you have to be fingerprinted, you have to turn your pockets inside out, you have to be metal wanded, you have to show your ID, all of that, right? So it's going to take 10 minutes. So there's no such thing as a 5-minute break at the exam site. Now, when you're studying, you could take a shorter break, but anything you can do to simulate the exam experience is going to help you. So one of the things I say to students is, a lot of you like to study with all sorts of snacks and beverages on your desk, right? And maybe the TV or the radio going in the background, but that's not what the exam is like. So you're better off studying in quiet, no distractions, no food and beverage around you, the way it's going to be the day of the exam. This way, your body and your mind are getting used to that. Does that make sense?
Yes.
Okay. Celine, I think you had a question.
My test is like right now.
Celine, Celine, you're
because I
breaking.
have a very bad experience in my field work.
Celine, you're breaking up, and I
Yes.
can't. I'm
Can
not
you hear
hearing you
me?
very well. No, can you text your question in the chat?
Yeah.
Yeah, you're breaking up. I can't understand you. Well, we're waiting for her to type in the chat. Does anybody else have a question? Oh, somebody's offering to be a study partner. That's actually, I'm glad you raised that, because part of your studying may be you want to get together with other people. Not necessarily every day. So maybe you study every day on your own, but once or twice a week, you get together with a buddy and you go over strategies together and you quiz each other and you talk out your rationales with each other. Most students find that very helpful. Are there other questions that people have?
I have a question.
Sure.
I guess going on the trend of like mindfulness and like anxiety and calming yourself down, kind of like when you get down to like the two answers of which one's the best, which one's better than the other, and you kind of have a hard time like picking between the two, because I know I sometimes like get that like test anxiety and like kind of tend to overthink it, and then I pick the wrong answer. So I guess like strategies for that type of scenario.
So here's what the strategy that I've been teaching my students. The first thing you do, you read the question, you read all the choices. All right. Then you eliminate, hopefully, two that you know are incorrect. So you've narrowed it down to just two. What I then suggest is that people focus on the outcomes. So you say, okay, if I pick the first one, what's going to happen? If I pick the second one, what's going to happen? Then look at the question again and see which outcome best matches the focus of the question. And most people tell me that that strategy really works well for them. So that you're looking at what's going to happen if I pick this. Okay, so Celine typed in her question, which is that she had, I'm sorry, I have a new puppy that is very noisy. I had a bad experience on my field work. How do I get over it? Because once I remember, I lose focus. Okay. So, I would think that in all of our lives, we've had good experiences and we've had bad experiences. So how have you gotten over other bad experiences in your life? All right. Sometimes people talk to, a spiritual counselor or their rabbi, priest, minister. Sometimes people pursue therapy, psychological counseling to help with that. Sometimes it's, okay, I'm only going to worry about this for the next 10 minutes, and then I'm going to go back to focusing on my work. In essence, you have to separate that was then and this is now. All right. If I let my past define me, it's going to follow me into everything I do. Okay. But I'm not going to let it define me, because I have a goal that I'm setting. And this is how I've accomplished what I've accomplished in my life, by setting goals and then accomplishing the steps I need to achieve that goal. I've had, I could tell you some stories, some awful things that have happened to me. And those could have defined me, but I didn't let them. I don't choose to think about them. I don't choose to dwell on them. I keep focused on what do I have to do now? So it does help to talk it out. Sometimes we're holding in feelings and then it's kind of like we're going to explode. Min, I see your comment about struggling with keeping motivation. So again, it comes back to goals. Why are you studying so hard? Okay, because you want to be an occupational therapist. You have to keep your eye on the prize, so to speak, right? If you want it bad enough, you're going to make some sacrifices now because you got to study. You're not going to be able to pursue, oh, I'd like to travel. Oh, I'd like to get married. Oh, I'd like to do a lot of things. But right now, I have a job to do. You know, I just got my program through accreditation. It was very hard. It was 5 years of very hard work. But I had to keep focused and I had to keep moving ahead because I had a job to do. Now that we just got our notice of accreditation, now I'm going to retire because I've accomplished my goal. And Lindsay, yes, you're right. It is a hard time of year. And especially when you've had a loss, first holidays are very hard, very difficult because there's a lot of memories. But I'm sure you have good memories. It's not all just bad memories. And those good memories are kind of what sustains us. So again, talk to people, don't hold it all in. And keep your eye on the prize. You know, I tell people to visualize your name with OTR after it. That's why you're studying. That's what you're doing. You want to become an occupational therapist. You can do this. You got into OT school. You got through OT school. Was not a cakewalk. Okay? You can do this. You've got to mentally prepare yourself for this exam. You've got to study. You've got to address all those gaps in your knowledge. And you can do this. So surround yourself with other people who are positive, who can build you up. All right. Don't be around negative people who are going to say, oh, you can't do this. And that's where, and Larissa, I just see your comment about group studying. Yeah, if you're, once a week, you're with a group of people, you're all in the same boat. This is a hard exam. This is probably the hardest exam you'll ever take, but you will get through this. You are capable of passing this exam. Okay. So, get some books on, those daily meditation books or thoughts every day, motivational quotes. Those are great. You can get an app on your phone and they send you a motivational quote every day. Anything like that is going to keep you positive. Any last questions? We have a few minutes left. Affirmations. Thank you, Larissa. That was the word I was looking for. Yes. Affirmations are great. All right. So I did not give you my email address, and I will put it in the chat now, which is donnacosta50@gmail.com. And if you have a question about exam preparation or something I mentioned tonight, don't hesitate to contact me. Study hard. Okay. You got this and you will succeed. Okay. Believe in yourself. All right. Have a good night, everybody. I wish you a wonderful holiday, whatever it is you celebrate. And welcome to the profession of occupational therapy. It is really an amazing profession. So thank you all. Good night.